All right, in this video, we're going to be going over the 3 best ways to whiten your teeth, my personal favorite, and then a list of common questions that I get asked by patients. So diving right into it, here's a quick 10-second review of how teeth whitening actually works or what it is. So teeth whitening is the removal of stains and discolorations from the enamel and dentin, essentially the different layers of your teeth. So hydrogen peroxide breaks up the stains and the discolorations on your teeth. It's really as simple as that. The important thing here is that all bleaching agents are going to contain hydrogen peroxide. Like that is the active ingredient that does the job. Notice how I said bleaching, not necessarily whitening. So the hydrogen peroxide breaks up the stains. And so if we want to whiten the teeth, we need 3 things. 1, we need the hydrogen peroxide product. 2, we need your teeth. And then 3, we just need time for it to sit on your teeth to do its thing. Now you might be thinking, well, I'll just go buy hydrogen peroxide rinse and just use that. Well, I don't think that'll get you the results that you want. When it comes down to it, the 3 best ways to whiten your teeth are, number 1, drum roll, please. Stupid. Number 1, in-office bleaching. So the in-office. Some examples of this might include the opalescence boost, the like that red bleaching agent you might see or have seen on some videos on the internet. Also the zoom whitening, where you think of the retractors, the patient laying back in the chair and the LED light kind of hovering over them. The in-office are the highest dose, the highest concentration products that there really are, applied directly to the teeth. And then of course we use some sort of liquid dam or material to protect your gum tissues to keep them from being chemically burned. Some of these will say to use the LED light, and then some of them don't necessarily require the LED light. Now, the pros of the in-office whitening are, number 1, it is the quickest and most immediate option to boost and enhance your smile. Secondly, a lot of times when you do the in-office treatment, your dentist or your dental office will make you a set of custom bleach trays. That way, after your in-office treatment, you can continue bleaching after the fact. Cons. Number 1, typically the priciest of all the options. Now, the in-office treatments, if you look and Google it, on average are about $650. It says between there and even $1,000. Number 2, increased sensitivity. Since you're trying to do so much kind of so quickly, this type of treatment often results in the most sensitive teeth from the whitening. Personal thoughts. We do the in-office treatment for some patients. It's typically not our go-to. If you're somebody who doesn't mind being a little bit more patient, I think the next option might be better for you. Number 2, at-home professional products. I include in these, the custom bleach trays that you might have made at your office that you put the gel into, the one-size-fits-all trays or strips, such as the Opalescence Go or the Crest Whitening strips. These are essentially the same ingredients, but just a lower dose. The pros. Number 1, these options are more affordable. Now, custom bleach trays could be a couple $100s, but typically all the other over-the-counter ones that you can buy on Amazon or at the store are going to usually range between $50 and $100, and those should typically last you a couple weeks, if not over a month. Number 2, convenience. You can pretty much do them wherever or whenever you'd like. Personally, I like to put mine in when I'm running an errand or going to the store, or often I'll put them in on my way to work after I've had my coffee and breakfast in the morning. Most of them are disposable, so then once you're done using the tray for that day, then you basically toss them, and then when you're ready to whiten again, you can just pull out your next pack and go. You're going to get the same results as the in-office whitening, but it's just going to take a little bit longer. So if you don't mind the trade-off, you're still going to get great results, but it's just going to take a little bit more time. Lastly, the majority of these products, not all, but the majority of these products will have some sort of built-in desensitizer. So if you're somebody who has sensitive teeth, they have ingredients in there to help kind of limit or at least reduce the chances of the teeth being sensitive from these products. If this is the worst whitening video you've seen and you haven't gotten anything out of this, please consider giving us a thumbs up and subscribing to the channel. So the cons of these, number 1, gum inflammation or irritation. This is a common one I see just because if you're somebody who's adding the gel yourself to the trays, or you're using a more of a one-size-fits-all strip or tray, obviously there's going to be more gel kind of getting or rubbing on the gum tissue, which can lead to more irritation sometimes. Number 2, they move around a little bit more when you're wearing them. So sometimes wearing them can be a bit of a nuisance, but it's usually not too bad. And once you get them in there, they typically stay put pretty well. Number 3, you have to be consistent with them. Like anything else, you get out of it what you put into it. And so if you're going to use the lower dose options, you have to just make sure that you're consistent with your whitening efforts. That way you get the results that you want. Option number 3, at-home maintainers. So some examples of what I consider maintainers would be the gel pens, the toothpaste, the different rinses that you might use. Now, I call these maintainers because the hydrogen peroxide doses are typically lower in pretty much all of these products. In my personal opinion, is that these types of products are more of a daily use kind of maintenance to help reduce the consistent buildup of stains. So at least kind of maintain the shade that you're at. Or of course, if you're diligent enough over time, probably enhance and boost the smile a little bit. So the pros, number one, they're more affordable. Number two, they're easy to use and you can typically use them multiple times a day. Number three, because of the low doses of the hydrogen peroxide, most patients will experience less sensitivity with these types of products. So the cons. My personal opinion is that if you're really looking to kind of enhance and whiten your smile, I don't know if these alone are going to get you there. Now, that's not to say they won't improve things, but in my personal opinion is that they're more of like an adjunct to treatments. Like you'd be using some custom bleach trays or the other at-home professional options, and then use the toothpaste, maybe a rinse, or the whitening pens throughout the day to kind of help kind of boost all of your other efforts and let those stack on top of one another. So what do I personally use? Well, my personal favorite one that I'm using right now currently is the Opalescence Go 15%. So this is kind of the highest dose hydrogen peroxide one that you can buy over the counter. You only really wear it for 20 minutes. It's easy, it's convenient. I get results with it and it doesn't make my teeth too sensitive. Now, I also have been starting to experiment with the Crest kind of whitening serum, which is essentially the little pen you can use throughout the day or apply. And then also I do use Colgate Optic White Advanced. So I use those three things. I probably whiten maybe once a week with the Go, a couple times with the actual Crest whitening serum, and then I use the Optic White actually twice a day. Keep in mind, guys, this is my routine. That doesn't necessarily mean that that's the best routine or it's the right routine for everybody. So if you ever have any questions as far as like, what's best for me? Is this going to work? Am I even a good candidate for whitening products? Always be sure to consult with your dentist, or if you have any questions and I can help, just leave a comment below and I'll try to help however I can. Okay, so a list of common questions I get asked from patients. How white will my teeth get? It's going to vary for everybody, but personally, I think age is one of the most important factors. So over time, the enamel on our teeth thins. As it thins, the next layer in, the dentin, begins to show through more. And because it's a darker layer or darker color, the teeth will just naturally appear darker over time. So, and even with the best whitening products in the world, you're not really going to notice too dramatic of a difference or increases as far as the whiteness of the teeth. So how white will they get? Well, I think the younger you are, the better results that you'll see with your whitening efforts. Will whitening damage my teeth? Okay, this is a really interesting one. So the studies show that the bleaching agents, the hydrogen peroxide, the carbamide peroxide, do in fact change the surface of the enamel. It can decrease the micro hardness of it, and it can increase the surface roughness of it. So if you bleach, the enamel does change a little bit. But these studies also say that our saliva kind of naturally offsets this. And so in addition to other remineralizing products such as fluoride, which is in toothpaste, or hydroxyapatite, which they have toothpaste for. And so there are changes that occur. They should be able to be naturally offset. And the big takeaway here is the higher the concentration of these products, then the higher the potential there is for these changes to occur. So if you're using the products as recommended, as the instructions say, if you're doing them in moderation and you're taking care of the teeth afterwards, my personal opinion is I don't expect them to compromise or cause long-term damage with the teeth as long as we're kind of checking all those boxes and following the process correctly. What about fillings, crowns, or other restorations that I have? Will those change color? So stains can be removed from these restorations, but they are not going to whiten the same as your natural teeth will. So if you're somebody who has fillings, crowns, or maybe a combination of all the above with some natural teeth, even after whitening, there's going to be some variation and they may not necessarily match all the way. How long will my results last? Well, this is going to vary for everybody, but I think the most important thing is your lifestyle and habits. So if you're somebody who drinks a lot of coffee, tea, blueberry smoothies, wine, soda, smokes, there's a lot of different factors, but in general, the more kind of stain producing activities you're doing, the more quickly or the least amount of time your whitening results will last. But in general, if you're somebody who's going to use the products and do kind of like the basics as far as brushing and not do anything too extreme, I typically tell patients the results will last about a couple months, maybe 4 to 6 months. Most patients in my experience who are going to whiten will continue to whiten over the course of like the year or their treatment, to where it's not like I whiten one time for 1 month and then I expect these to last for 6 months without the teeth changing. It's kind of like going to the gym. You don't work out one day and then get fit for 6 months. It's just like small daily or weekly things that you do, and over time you just see the results and let those build. What if I have sensitive teeth? This is a common question, and teeth can be sensitive for numerous reasons, but here's a couple things that you could try. Number one, if you've already bought some product, you could try and decrease the actual amount of time that you wear them, even if it's less than what it's recommended, and just see how your teeth respond to that. Secondly, you could just try a lower dose or lower percentage product to see if by cutting back on the strength of the product, the teeth respond the same way. Also, you can use desensitizing products prior to whitening, such as sensitivity toothpaste, prescription toothpaste. I mean, they even sell desensitizing gels. Keep in mind too, with these products, a lot of the instructions on them, particularly the toothpaste, will say don't rinse for 30 minutes afterwards. So after you brush, you spit, and then you can let those ingredients sit on your teeth to basically have their maximal effect and reduce your sensitivity. And then lastly, if you're buying whitening products and different solutions online, just make sure you're buying them from reputable brands where the products will not dehydrate the teeth too much, because that's one of the causes of the sensitivity from the process. Should I brush before or after I whiten? This is kind of a tricky one, and you might see mixed things on the internet. So of course they're going to tell you remove as much stain and plaque from the teeth before you whiten as you can. Yes, but in my experience, if I've brushed a little bit more aggressively before whitening, 5 minutes, 10 minutes, 20 minutes before, I've noticed that the whitening products actually irritate my gums a lot more. And so in a perfect world, you would brush, basically not consume a whole lot of other things, and then maybe wait at least an hour afterwards to then go ahead and whiten. Are there just some cases where the whitening products won't work? There are some instances where if patients have maybe a particular genetic condition, or they have like tetracycline staining from antibiotics or things, where if the stains are intrinsic and they are kind of just so deep within the tooth that really there's not a whole lot you can do to actually kind of lighten or brighten the teeth, even with all the different products in the world. If the teeth are intrinsically stained significantly enough, sometimes the only way to actually brighten them is to do some sort of restorative, such as composite veneers, or actual ceramic veneers. Can I use my retainers as custom bleach trays? So retainers are a little bit more rigid, and they do fit very closely to the teeth. And so if you have them and you don't want to buy custom bleach trays, I tell patients, go for it, try it. You got nothing to lose, honestly. But I do tell them, put a little bit of the bleaching agent in the tray, not too much, because then when you seed it, obviously more of this is going to be extruded, so it could irritate your gums a little bit more, and then you're not really sure how much of the bleaching agent is actually still hanging out on the teeth. The whitening trays are a little bit more kind of loose or passive fitting, and they have room for this to offset it. So I would say try it. If your gums get really irritated or you don't notice like a huge difference, then I would switch to the disposable ones or look at getting a custom set made. If you guys got any value out of this video, give us a thumbs up. Consider subscribing to the channel. I appreciate your guys' time. I have links to all the products that we've mentioned in the description below. They are Amazon affiliate links, just so you know, but there are links to, if you guys want to look at the products or like dive a little bit deeper to see if any of them look like they're the right ones for you. So thank you.